To start us off, we are starting with a special brief from the Director General of Africa CDC, Dr. Jean Kaseya, and that will be followed up by a Q&A session after the briefing. Just to let you know, we have also special experts who are joining from online who also will be answering questions when called upon. Over to you, Dr. Kaseya.
I was muted, I'm sorry. Good morning, good afternoon, good evening for some of you. Welcome to this session where we want to give you an update on where we are with this outbreak and what Africa CDC is doing to help our countries to control the outbreak. I will share with you, I think some of you can see my screen. I will share with you a couple of slides. I think I have your first slide that can help you to understand the situation. But please let me first say, we are seeing an increase in terms of outbreaks in Africa. We are moving from almost 2 new outbreaks per week to 3 new outbreaks per week. Last year, we had 167 outbreaks across 42 AU member states. And what we call the top 5 most reported outbreaks in Africa include Mpox, we are talking about it today, cholera, dengue, measles, and Lassa fever. These outbreaks contribute to 77% of all cases and 81.4% of deaths in Africa. But let us talk about Mpox, and you will see in my screen that we have currently 16 countries affected in 2020. All 5 regions are affected. It means, as you can see the map, north, south, east, west, and central. And you can also see that we have 18 countries that are at high risk to be affected. What is critical to know, in the past 5 days, we have 6 new countries affected. And we want also to share with you that the mode of transmission, it's mostly the contact with people who are infected or animals infected. But as you will see when we'll discuss some data, we have this sexual transmission, mostly people who are having multiple sexual partners are having risk factors to get Mpox. And we are also discussing the correlation with HIV, because in some countries, most of people with Mpox disease are HIV positive. We also discussed the role of malnutrition, because we saw in a number of cases people having malnutrition. But let us remind you, Mpox was declared public health emergency of international concern by WHO, like COVID, from July 2022 to May 2023. It means where we are fighting COVID, at the same time we have another public health emergency of international concern. I then want to share with you this figure that can help you to understand why Africa CDC is today taking strong action. You'll see that from 2022 to 2023, we have an increase. Please see in green this is the 2022, in yellow, the 2023. For the same period of time, we didn't, just the way we presented that, but for the same period of time, there is an increase in terms of number of cases that was more than 79%. But if you compare 2023 to 2024, the same period of time, there is an increase of 160%. The total cases in 2024, 15,132, is increasing and will be more than even the double of what we got in 2023, even more. This is one of the aspects that is alarming us. Another one that is alarming us is this one. You'll see from the information that we got, this is to give you an idea in terms of how cases are increasing if we compare with other period of time. And you will see it's mostly, and we'll talk about it, driven by cross-border transmission linked also to sexual transmission. The last one I wanted to share with you in terms of slides, when, as I told you, we had the public health emergency of international concern, look how cases were. If you compare where we are today, we saw a huge increase, that justifying the action that we are taking. Now, what we are doing today in Africa CDC is to understand a number of factors, especially to understand why there is this increase of cases. This increase is due first to how the virus is mutated to the new routes of transmission. We know initially it was just the contact with animals and human beings. People were affected, but today the sexual transmission, mostly on the clade 1 in DRC, is transmitted in other countries. This one is explaining the increase of cases. We know also the late detection and management of cases in affected countries is a major issue. And you will see, as an example, I will show you that in some countries, like in Kenya, like in Côte d'Ivoire, we still have cases, what we call identified cases, because we are not ideally testing all cases. In DRC, we were testing only 12% of samples. Today, there is an increase to 31, 32%, but it's still too low because we need to test almost all samples and to make sure that we have accurate response. One of the reasons also that can explain this increase is the socio-political crisis. And if you see the eastern part of DRC, where all cases to Rwanda, to Burundi, to Uganda came from, this eastern part of DRC is affected by the insecurity. And that one is driving also the increase in terms of cases. We will not stop saying loudly the role of climate change, the role of increased exposure of humans to wildlife. This is why we say fighting Mpox is also a climate change issue. And it's calling for a One Health approach We can discuss that later. More important, if we see the epidemiology, how it's moving, for CLED2 in the past, we had more. I stopped sharing because you got what was important in terms of slides. If you compare DRC now with other countries, with CLED2 in other countries, we had more adult and male. Today, the epidemiology is changing in DRC. 60% of cases are children under 15. And if we increase to those who are under 18, we are talking about more than 70% of cases. And we know that there is this sexual transmission. This one is a major alarm for the world. We are losing the youth in Africa. We are also talking about new countries where Mpox was not notified in the past. These countries are what we call non-endemic countries, like Burundi, like Kenya, like Rwanda, like Uganda, are now reporting for the first time in the history Mpox cases. This new incident demonstrates the need for a collective and collaborative approach in curbing the spread of the disease. What are key challenges in terms of Mpox response in Africa? As I said, the first one is the insecurity. The second one is limited understanding of epidemiology and transmission dynamics of Mpox in Africa. We are talking about the correlation between Mpox and other diseases like HIV. We are talking about the change of epidemiology. Why in countries like DRC, we have more young people and female, while in other countries, we have more male and adult. We need to understand all of that. Let us also say there is, as another challenge, inadequate global attention and resource investment in the control of the disease. Mpox didn't start yesterday. Mpox started, as you saw, even there was a public health emergency of international concern. But we didn't benefit from a lot of attention. This is why today we really need attention from all of our partners and colleagues from other continents to understand that our major focus today is to help the continent to address this issue. Another challenge is the complexity of the outbreak context with other multiple outbreaks and the humanitarian event. We know we still have ongoing cholera outbreak. My team was informing me about suspected cases of Ebola again in DRC. We still have other humanitarian situations ongoing. That one is also affecting our capacity to address the issue. And the last one, as we identify as challenges, can be the unavailability of what we call the countermeasures. Countermeasures are vaccines, are therapeutics, are diagnostics. I already shared with you the average of testing is only around 30%. I already shared with you that this is a cross-border transmission. It means we need to test in all points of entries. Otherwise, we are, as it was the case in Kenya, it was a driver of a truck moving from one country to another one transiting through Kenya, and he was tested while he was in Kenya. We need to have vaccines. Today, we are just talking about almost 200,000 doses available. While what we know from countries having vaccination plan, we need at least 10 million doses. This one is a major issue. Then what Africa CDC is doing? First, wanted to thank President Lourenço from Angola because he negotiated a ceasefire in the eastern part of DRC. And want also to thank President Tshisekedi and President Kagame for accepting that. We want to call to all parties to help Africa CDC and partners working with us, WHO, UNICEF, MSF, and all partners who want to call the two countries to give us access to the population, to vaccinate them, and to support the response to this outbreak. I will have opportunity to meet President Lourenço in a few days in Luanda. I will have opportunity to talk with President of DRC and Rwanda. I will request a call with them to see how we can continue from public health side to maintain a kind of momentum for vaccination and support to this population that are affected, and that is spread the outbreak that is spreading now to all countries in the eastern part. We want also what we are doing as a lead Continental public health agency. We are committed to mobilizing resources and providing technical assistance to affected countries to control outbreak. Ladies and gentlemen, in line with Article 3, Paragraph E of Africa CDC Statute, approved by Head of State during the AU Assembly, I read, Paragraph E, Africa CDC will declare a public health emergency of continental security in close consultation with affected member states and as appropriate relevant stakeholders. And paragraph F is saying Africa CDC will coordinate and support member states in health emergencies response, particularly those which have been declared public health emergency of continental security or public health emergency of international concern emergencies, as well as health promotion and disease prevention through health system strengthening by addressing communicable and non-communicable disease, environmental health, and neglected tropical disease. As you know, at global level, it's the mandate of WHO to declare the public health emergency of international concern. At continental level, for the 55 countries in Africa, it's the mandate of Africa CDC to declare that. And when Africa CDC is declaring that, it's declaring what we call the public health emergency of continental security. And for us to declare that, we have to follow a number of steps. This is why I already started active engagement, first with member states, to understand the magnitude of the issue, the level of response, the trend of this outbreak, and the appropriate action to take to avoid this outbreak to become another pandemic. I already discussed and I had communication with the president of the chairperson of African Union Commission, His Excellency Moussa Faki. And in about 2 hours, I will talk with His Excellency Mohamed Ould El Ghazouani, the president of Mauritania, who is also leading African Union and is also the president of the Committee of Head of State of Africa CDC. My role is to brief all of these political leaders to understand where we are moving with this outbreak and to give me the appropriate political guidance on the way to move forward. I'm in close contact with Dr. Tedros, the WHO Director General, and I thank him for his support to African agenda and to the way we are working together. I had a meeting yesterday with what we call the Pandemic Preparedness, Prevention and Response Commission. This is the commission that is supporting President Ramaphosa as the champion for PPPR. And tomorrow, I will have a meeting with the two regional directors, WHO in Afro and EMRO, it means the Mediterranean region, because in Africa, we have 45 countries that are Afro countries, and we have 8 countries that are EMRO countries. It means we are putting the two regions together. I will also have meeting with the 3 regional directors, UNICEF, EMRO, Western Central African, and Eastern and Southern Africa. This meeting will lead for other meetings with other partners. On Monday, I will have a meeting with African experts and international experts. This is a group called Emergency Consultative Group. This is the group where we have all African geeks, all African epidemiologists, all African lab people, and a number of skills who will review all data. They will review the response so far, and they will make a recommendation to the Director General of Africa CDC in terms of the declaration of public health emergency of continental security. Immediately after this meeting, I will have a meeting with the Africa CDC board, governing board. The governing board of Africa CDC is where we have 10 ministers representing all regions, plus a number of partners, for them to be briefed on the conclusion that I got from the epidemiology consultative group in terms of declaration of public health emergency of continental concern. After all of these consultations at technical and strategic level, I will have a call on Tuesday with President Gazwani, with President Ramaphosa, with President Moussa Faki, to brief them on the conclusion and to get the blessing and guidance to declare the public health emergency of continental security. Immediately after that, we'll start to prepare extraordinary summit, African head of states, to take place very quickly, a summit that President Gazwani will call in his capacity as the President of African Union, to discuss Mpox and the response that we need as Africans and partners to bring to support our countries. At Africa CDC level, for now, we activated the Emergency Operations Center to support the preparedness and response effort of our African Union member state. This one aims to enhance coordination and provide technical support. We also deployed a strong team, and we appointed an African incident manager. Dr. Ngashi was attending this meeting. This team is now based in DRC to provide a regional response, not only for DRC, but for all African Union member states affected. And he will have opportunity during this press conference to debrief us on actions they already they are taking and how things are moving on the ground. They are working together with our WHO colleagues, our UNICEF colleagues, our MSF colleagues, and all other partners who are involved. Let me say, so far, we have so many partners coming and working under the leadership of Africa CDC to respond to that. But because we are serious in Africa on the way to deal with this outbreak, we thank our ambassadors in the African Union under the leadership of what they call the Permanent Representative Committee that approved an emergency release of $10.4 million to support the Continental response to the outbreak. This funding is helping us to start negotiation with a number of partners. I want to thank the European Union under ERA. I want to thank Belgium for the coordination we are putting in place to quickly secure needed vaccines for Africa, and also how to strengthen the surveillance system. We are working together with the US team. We are working with CEPI. We are working with Wellcome Trust and a number of other partners to strengthen the response in DRC and other countries. I want also to say Africa CDC recruited anthropologists and social scientists to support with strategies aimed at improving understanding of ethical practices that put the population at risk, like consumption of bushmeat, like behavior change, because this is also a sexual transmitted disease. I wanted at this level to say we are advocating strongly and we are coordinating a number of subcommittees on surveillance, on diagnostics, on communication, on vaccine and therapeutics to ensure that we have a holistic view on the way we are addressing this outbreak. In terms of vaccine, we have a limited availability of vaccines. That one is a major challenge. This is why every day we are calling for local manufacturing. I was saying local manufacturing of vaccines, medicines is the second independence of Africa. And today, while we need 10 million doses, we have only 200,000 doses. And we need to redo our plans to start with this 200,000 while we are actively engaging a number of partners. I want to thank CEPI, I want to thank BioNTech and other partners who are working with us to see how we can finalize quickly the clinical trials that are ongoing for us to have millions of doses next year to continue with this campaign. But we'll start with the 200,000 doses that are available very soon based on the vaccination plan that we are getting from countries. Ladies and gentlemen, let me stop there and give you opportunity to ask. And I'm not alone, I'm with my team. We are available to answer your questions that can help our communities in Africa and in the world understand the magnitude of this outbreak, the decision that we are taking, and what will be next after declaring the public health emergency of continental security. I thank you.
Thank you, DG. We are now opening the floor for questions. I can see Lizzie Otaye, you can come in.
Hi, so Doc, just a quick question. I know how big it is when we're talking about epidemics and pandemics. The key, I got muted, sorry. So the key issue is usually infodemics, misinformation and disinformation. And what we've seen, and in the case of Kenya, is when there was an outbreak of the truck driver and there was contact tracing that was being claimed was going to happen, then because there's protest going on, there was a case of misinformation, and they're saying now the government is using this to scare you so that you do not go to the streets. So there's a whole lot of issue, and there are a lot of thousands of youth who are going out to demonstrate, and we know very well with Mpox, it's all a matter of contact tracing. I mean, the means of transmission and having all those youth in the streets kind of raises the spikes high. So I just needed to know, what are you doing in terms of addressing misinformation and disinformation? And also, are you using the platforms that, you know, we find the youth at? You know, these are the social media platforms, unlike them logging in on LinkedIn or doing a Zoom call. And we know pretty well contact tracing is the key. We need to figure out where the truck driver was, who he was with when he made his trips across the three countries. How efficient is contact tracing? Because we saw this was a big challenge during COVID-19. So I just need to know how we learned our lessons and have we put in measures to mitigate such kind of issues. Thank you.
Thank you so much for your question, and you are right.
Thank you.
Okay, Margaret, I'm guided by you. Okay, thank you. You want me to answer?
Yes, you can go ahead.
Thank you. No, you are right by raising the issue of infodemics, because we really want to make a clear distinguish between politics and public health. This outbreak is a reality. This is why media, you are here today to spread the information, to say it's not just for Kenya. We are talking about almost 34 countries in Africa affected and at high risk out of 55 countries. And we are talking about an outbreak affecting 5 regions. It's not just one region. But if we go in the context of Kenya, we know we have a vibrant youth movement. And we are working with the youth. We know that they are connected. And we have a dedicated department in Africa CDC who's working with them and helping them to get appropriate information that they can share with other young people. Please don't forget, as I said, in DRC, more than 70% of people affected are less than 18 years old. It means we are talking about the youth. And we need them to come strongly. In our response, we have what we call risk communication and community engagement. For that, we are having a strong communication campaign that is addressing the issue mostly in the youth. But because we are Africa CDC, we are coordinating the response at continental level. I had a call even before being sworn in with the new minister of Kenya, Deborah Barasa, and I was informed that she was sworn in yesterday. I think she knows that this is the first priority at continental level and then at country level to develop an appropriate response. And I'm working closely with the minister, but also with all authorities in Kenya to see how we can strengthen our response, because we learned from COVID and we don't want to repeat the same mistake. This is why today Africa CDC is strongly coming to respond to this outbreak as appropriate way to move forward.
Thank you, DG. We are now moving to the next question. John Cohen, you have the floor.
First of all, thank you so much for doing this. It's really helpful. Who will pay for 10 million doses of vaccine, and how will they be distributed? Who will they be offered to as target populations? And you mentioned 200,000 doses. I'm only aware of 50,000 doses in DRC and 10,000 in Nigeria. So what are those other doses, and where will they be distributed? And what's the timeline for all of this?
Yes, thank you, John. Let me be clear on that. Africa didn't request donation. My voice is clear. As Africa, we are requesting contribution. This is why we got this 10 million. Part of the 10 million, we are contributing for the procurement of vaccine. It means even if our contribution will be 10%, it's our contribution, others they are contributing 90%. First, I want this narrative to change. We are not just a continent of donation. We are also a continent of working together, contributing together for the well-being of our communities. Second, because we are talking about donation in the past, people they were giving numbers they could give. But now what we did, we went to sit with the company that is manufacturing the vaccine that we are using for adults. It's not a secret, it's Bavaria Nordic. We requested them to give us the number of doses that they have. They said we can go to 200,000. We say, okay, what is the cost? We started to partner with European Union, and I thank European Union for the support they are giving us. And there is what we are building together with European Union and Africa CDC. I thank also WHO, Dr. Tedros was sharing with me yesterday the effort they are doing to support this dialogue. I thank Gavi. They were talking with my team on how we are also moving together. These 200,000 doses are available now, and we are finalizing very quickly the discussion that we have to have them in Africa. How it will be distributed, it will be based on countries having a vaccination plan. My team, even this morning, they had a meeting with all countries affected to see how to support all countries to have vaccination plan in place. And will be led by that. Each country is defining, based on the availability of vaccine, what will be the best approach and the target. And Dr. Ngashi will come up quickly on that to give you some information. And will be moved, will be led by that. By also knowing that, like BioNTech, they already started the clinical trials. They finalized the phase 1. Now they will start with phase 2 and phase 3 to ensure the safety of vaccine. Next year, we'll have millions of doses using the same platform that we use for COVID that helped us to have 4 billion doses. And next year, we'll have millions of doses to cover our needs. But for now, we are starting slowly based on what we have and based on the national plan. Dr. Ngashi, quickly, do you have something to add regarding the vaccination plan and how things are moving?
Yes, thank you very much, DJ. Just to follow on what you have already said, I think we had a teleconference this morning with the directors of National Public Health Institute of the affected countries. I think the 16 countries that you spoke about, just to take stock of how many do have plans already, so we can pull together the needs in terms of the vaccines that they need. 7 countries do have plans, and 2 are in the process of finalizing. That's already 9. The incident management team here is pulling all that together to look at the overall needs in terms of the vaccine that countries need. But on the question that John was asking, one thing that given the fact that already DRC, the needs in DRC is 3 million, the DG just said that what we can get now is around 200,000. It is clear that we are going to move into a phased approach where we are developing criteria for the phasing. Where do we start? It is obvious that we are looking at criteria on 2 grounds. One on the geographies. That's why we'll be looking at the hotspot, the areas of active transmission, but at the same time also looking at the population most vulnerable, including healthcare workers, including the contact of the cases that have been already identified, and also including vulnerable populations like people living with HIV. As I think this morning, what was very interesting, the report from South Africa, is the fact that mortality so far in South Africa is above 10%, because most of these people are people living with HIV as well. I think those are the criteria that we are considering now for the rollout. I think there was also another question, DG, that was looking at the contact tracing, which is perhaps one of the weakest link in many of the countries. What we are now working with the NPHIs is to strengthen surveillance, so to really reconstruct the trajectory of the different patients, but at the same time also reactivate community health workers as an important resource for not only for the surveillance itself, but also for the contact tracing of those that have been identified. I think with those 2, and then the third element we've also included in the digitalization of the system, right from the community to the primary healthcare facility level, to be able to get that report on both surveillance and contact tracing in real time. That's why you've seen the spillover of these cases, in neighboring countries, because also the contact tracing part of the surveillance has not been optimal up to date. Thank you very much.
Thank you, Dr. Ngashi. The team told me there are some questions related to declaration of a public health emergency of continental security and what will be the benefit of that. And this is critical. As I said, maybe next week we'll declare that. I gave you a clear timeline and consultations. That one, I said there is what we call divisions for labor between WHO and Africa CDC. In Africa, it's Africa CDC declaring that at international level, other continents are also affected. It's the mandate of WHO. If we declare today the public health of continental security, they will have some critical changes and actions. The first one will increase the coordination. Africa CDC will coordinate the international response and provide support to countries to contain the outbreak. And member states, they will start actively, promptly, and transparently to share information to Africa CDC that will be coordinating with all partners, WHO, UNICEF, and others, as I said. The second one will be what we call the international notification, because the declaration will obligate our member states to notify to Africa CDC of any health measures implemented in response to the emergency. As I said, we'll have the summit of head of state. That one will be a decision from head of state to our member state. The third one will be about mobilization of resources. When we declare a public health emergency of continental security, we are increasing funding, domestic resources and partners' resources to support the outbreak. we are also increasing or enhancing the surveillance and the reporting, because countries are expected to enhance their surveillance, including at point of entries, because I saw a question about how we can strengthen that. We know how to do that, and we have a team doing that, and Dr. Yenu and the team can come to give more information on that. But we know how to report on that because we know how to collect data, and this is something we need to do. Another benefit will be public communication. Africa CDC will start to communicate regularly, like this press conference will have it on a weekly basis, and will start to provide to the public how the outbreak is moving and what all of us we are doing to fight the outbreak. Another benefit will be in terms of R&D, research and development. The declaration will accelerate research and development of diagnostic. Yesterday I was talking with my brother, Professor Amadou Sall from Institut Pasteur, Dakar. He was telling me, once we declare, they will make sure that all African manufacturers of diagnostics, they will provide diagnostics for Mpox. It means all of them, they will work together. And this morning I was talking with the senior vice president of BioNTech, who also told me, with this declaration we'll make next week, they will accelerate the phase 2 and phase 3, and also scale up the production of vaccines. That one is another benefit, the last one maybe, will help us to strengthen the international support and solidarity, because the declaration will foster international solidarity and encourage countries to support each other. It's not just about the country, all of us together, through knowledge sharing, resource allocation, and better coordination. This is why this response will not be led by the Director General of Africa CDC, will be led by the President of African Union, the President of Mauritania, supported by the President of South Africa, who is the PPR champion, with the Director General of Africa CDC. It means Africa at political, strategic, and technical level are coming together. Then we have our partners coming to support us. I think I'm clear on that. And this is how head of state they wanted it in Africa. This is what we'll do. Thank you. Meg, back to you.
Moving on, yes, thank you, DG. Moving on to the next two questions. Paul, I can see your hand, you have the floor. Paul, can you hear us?
Yes, thank you very much for this opportunity. So I have a couple of questions. The first question is, you mentioned that we are seeing lots of cases among children. From the epidemiological data that you have, do we have an idea of how the children are getting infected? Then you've also told us what is going to happen with the public health emergency of continental concern declaration that we're expecting to possibly have next week. Looking at the experience of 2022, when a similar emergency was declared, although by the WHO, and you referenced it that we didn't have much impact. So can you do a sharp contrast of what happened then and how we will do things differently right now? And if I can chip in a third one, how recent is the data that you are sharing about the epidemiology? Thank you very much.
Thank you. We will take the next question before the DG can respond. Janice, you can come in, you have the floor. Janice, can you hear us?
I can hear you, yes. Can you hear me fine?
Yeah, we can hear you. Go ahead.
Thank you very much. Mine, thank you to the previous questions. Some of those were what I wanted to ask, but can I just clarify? I'm probably just missed something here, but when we are talking about the declaration for the public health concern of intercontinental concern, are we talking about the fake that Dr. Tedros was speaking about yesterday when he was talking about bringing a panel together? Are these two different things? I'm not too clear on that. But more technically, I'm just wondering if you could, in the most simple terms possible, explain in your view why it's taking so long to get vaccines. I realize that it's a numbers issue, but I've been in touch with some of the companies that produce smallpox and Mpox vaccines, and when I look at what is being said by NGOs, etc., on the ground, it doesn't seem like there is much happening on the ground, and maybe I'm just wrong on that. But if you could explain why it's taking so long. Obviously, Mpox has been endemic in Africa for decades, and we've known that there's been a shortage, and this outbreak is rapidly evolving. But yeah, I mean, the actual local manufacture of vaccines, understandably, as you were saying, only really going to happen for next year, and a lot can happen between now and then.
Thank you, Janice. Over to you, DJ.
Yes, I will ask Dr. Merawi to provide some information for the question asked by our colleague Paul in terms of how children are infected, and also to discuss some data. But from Janice, I think I already explained it. If you want to understand, let us take a country like Canada. You have the government at federal level, but you have also states that are led by a prime minister. I think they are what we call, we are sharing responsibilities. In Africa, as we said, based on the statute of Africa CDC, based on the willingness of head of state to declare the public health emergency of continental security, is the mandate of Africa CDC. This one, it's known by all of our partners. And as I said, Dr. Tedros also knows we are discussing that. And but that one is not it's not contradicting what WHO will do at global level, because WHO can also, using data coming from Africa and projection about what can happen in other continents, and declare also public health emergency of international concern, that is at global level. Our action as Africa CDC is in Africa, and we are coordinating the response. At global level, it's WHO, and coordinating the response at the global level. I think that one is clear. And my brother, Dr. Tedros, and myself, we are discussing that regularly, and we are very well aligned. There is no issue regarding that. Why it takes too long to get vaccines? Yes, we can talk about so many other vaccines. Why it took too long to get malaria vaccine? Well, our people were dying from malaria for a very long time. Why it took too long to get other vaccines where we have diseases? Why Africa doesn't manufacture their own vaccines? This is another issue that we are talking about. I think now let us see things on more positive way. Let us say that Africa CDC is there to take the lead in all of these areas from African side, and local manufacturing is our critical flagship, and we are moving with that. Dr. Merawi, maybe for our colleague Paul.
Thank you. All right. Thank you, DG. Thank you, Paul, for that important question. First off, just we shall note that monkeypox doesn't prefer any age group or so, but why children are much affected is a very good question. One, monkeypox is endemic in our region, and when it is endemic, exposure will be there, and children are more vulnerable. Vulnerability in a case because of contact, as well as vulnerability because of malnutrition and immunity status of these children. Why this thing is much higher now compared to adults is because that there are maybe different variables and factors, but this is also another version of it is because vaccination in those days for smallpox has some level of protection for the old age group than the children, which are not yet have such exposure before. So this one, the endemicity, the immunity status, including malnutrition. Malnutrition is highly rampant, especially when in our region, and when it comes to children, over 40% of children are malnourished. This is another factor, in particular when it comes to this region. So these are some of the variables that we're really thinking for why children are much affected. Thank you.
Thank you, Dr. Merawi. We have 3 minutes left. We can take one more question before we close. Obina, you have the floor. Keep your questions short, please. Obina, can you hear us?
Yes, I can hear you. Can you hear me?
Go ahead. Yes, go ahead.
Okay, thank you very much. Good day, everyone. Good day, Dr. Jean. Yeah, so my question is concerning the communication campaigns that need to go alongside any vaccination plans within countries. You did mention tonight about Nigeria about to receive 10,000 doses of the vaccine. So in line with that, my field is in risk communication and community engagement. And we are concerned about, what are the communication strategies that we can use to ensure adequate uptake of the vaccines when they arrive in the country. So my question is to ask, has the Mpox vaccine been deployed in DRC? And if so, has it been administered to persons living with HIV? I am asking this because we did mention that people with HIV are at most risk for Mpox, and we are considering vaccinating such populations within the country. So again, my question would be, is there any interaction seen so far in DRC with the vaccine and antiretroviral vaccines? Are there any side effects that have been reported among the clients? And then finally, are there any recommendations to clients regarding such side effects? Thank you, and over.
Thank you. Because we are talking about the DRC, Obina, and Nigeria on the communication plan, let me hand over to Dr. Ngashi, who is in DRC with the team, who can help to get information. Dr. Ngashi, can you please provide some response to our colleague? Dr. Ngashi, you are muted.
Yes, thank you very much, DG. The first question about whether DRC has introduced Mpox vaccine, the answer is not yet. I think they have planned, they have developed the risk communication and community engagement strategy, but the vaccines are not yet in the country. I think there are two negotiations that are going on, one with the government of Japan for the 2.5 million doses, and then another with Bavarian on the other side for the MVA vaccine. I think all that is still in the making, but the team here I think the Africa CDC team arrived 2 days ago, and we'll be reviewing this afternoon the risk communication and community engagement strategy of the country. And that is one area that has been also identified already. And the DRC has some experiences with the introduction of COVID-19 and also the rejection that they went through at the beginning. I think some of the strategies that came as part of the lessons of that is the fact that at the beginning it's to be very important to ensure that that communication targets, first of all, the providers themselves, so to prevent the kind of resistance that was the health workers resisting the COVID vaccine. That would be some of the primary target. And secondly, I think based also on that experience, is the fact that it will be very important to also use the influencers to also be among the first one to be vaccinated and have the entire communication about that to see that the leaders themselves can take the vaccine and there's acceptance already from the main influencers. I think that would be also something that would be needed. Now, there was a question on HIV. I think we did discuss that here. We heard about cases of co-infection in South Africa. We haven't seen that in the DRC. But it is something that we're already preparing with them, how the communication can already address that, because with the sexual transmission and looking at the places where this is happening, it is most likely that some of the cases of co-infection will be also identified. But then what is also important that people that are infected with Mpox and HIV, it will be extremely important also to link the two programs. That's why we had a discussion with the Minister of Health this morning, and we emphasized on that we need to bring in the HIV program, we need to bring in the PEPFAR team to ensure that all those people that are not yet on antiretrovirals also benefit from both intervention, including antiretrovirals, to make sure that they are really they are strong enough to be able to also support the intervention that will come on the Mpox side. I think that's where the DRC is. It is good timing because they haven't yet started. That gives us enough time really to prepare for the launch of the vaccination, taking into consideration all those key elements. Thanks, DJ.
And thank you. That to add, in Nigeria, Professor Mohamed Pate, who's minister, we are in regular contact, is doing a great job. He's putting together the team to work on that. And I can ensure that across all African countries, we are in communication with ministers and the technical people to see how the communication plan, learning from COVID, will help us to address the infodemics we are talking from the first question we got about Kenya for the introduction of this vaccine, the Mpox vaccine. Thank you.
Thank you, DG. Given the number of questions that we have, we are going to take at least 3 more questions. Sarah Javing, I can see your hand. You have the floor. Sarah?
Can you hear me now?
Yeah, we can hear you.
Okay, great. Thank you so much. Can you please clarify whether Africa CDC has declared a public health emergency of continental concern before, or will this be the first time if it is declared next week? I know that this is a new power for the changing structure of the agency. And additionally, you mentioned some suspected Ebola cases in DRC. Can you provide more information on that? Thank you.
Thank you, Sarah. We'll take 2 more questions. Saidu Diallo, you can come in. Saidu, can you hear us? Saidu, you're on mute. Saidu? All right, we'll move to the next person. Kemo, you can come in.
Hello, can you hear me?
I can hear you. Go ahead.
Thank you. So I am in Freetown, Sierra Leone, and I've got to tell you, we are not hearing anything virtually about Mpox. I mean, maybe that has to do with the communication at the government level. If they are doing something, then clearly from presentation today, we have a long way to go. But I have a feeling it may also be because it hasn't impacted us as much as it has the countries the Director General has focused on. In any case, if you can just speak a little bit on how much our surrounding, you mentioned Ivory Coast. I don't know how serious it is in Ivory Coast. How much our surrounding is affected in West Africa, and what a country like Sierra Leone, how much should we concern? I mean, should we be concerned about this for a country like Sierra Leone? Thank you.
Thank you. Let's take one more. Esther Nakazi, you can come in.
Thank you very much. Can you hear me?
Yeah, we can hear you.
Yeah, what are the efforts to engage the private sector in this, and what is the cost of a vaccine for Mpox? I mean, for the two companies that are supplying, what is the cost if the governments wanted to procure for themselves and not rely on donors? Thank you.
Thank you. Over to you, DG.
Thank you so much. Let me start with Esther, the last question. We cannot respond to this outbreak without the private sector. And this is why I was talking about the PPPR Commission under the leadership of President Ramaphosa. We are calling for a meeting with the private sector, as we did for COVID. You know, the major role played by Afrexim Bank, by Strive and other AFDB and other components of the private sector in Africa, but also in the world, because Africa CDC got funding from many philanthropies, even individuals in the world. And we believe that private sector, it's also manufacturers, it's also other companies that can come to support the response. Yes, clearly, we are working with the private sector, and you'll see, because I will talk to you on a weekly basis, I will brief you on the ongoing effort in this area. What is the cost of vaccine? Thank you for asking that. The vaccine is so expensive. 85 euros per dose. 85 euros per dose. It means if we consider some fees, we can put it around $100 per dose. There is not so many countries in Africa that can afford the cost of this vaccine. This is why we are partnering with manufacturers to see how they can continue to reduce the price of the vaccine. And when I'm discussing with them, I'm clear on that. Second, we are also partnering with our member state. This is the 10 million that we got to contribute to buy some additional doses. And we are also working for our partners, external partners, to see how they can contribute. I will maybe next week to give more information about what we are doing with European Union under ERA, the humanitarian body of European Union, how they will help us to procure the 200,000 doses that are there with the contribution of Africa CDC. I think this is something important. And as Africa, we need to speak with one voice. And we will be so powerful if we speak with one voice. And this is what we are doing in this area. Regarding Sierra Leone, Kemo, you are right. If you see the map that I presented, Sierra Leone is neighbor of Liberia, and Liberia is affected. And I know the two countries. I know how people are moving between the two countries. It means Sierra Leone, if we don't strengthen our surveillance, if we don't provide appropriate communication, we can be surprised by number of cases in Sierra Leone. Yes, Sierra Leone is also at risk, even if it didn't come clearly in terms of color in the map, but it's also at risk. In terms of what Sarah asked about the declaration, yes, it will be the first time because this mandate was given to us in 2023. It will be the first time for Africa CDC to declare the public health emergency of continental security. And we need to know that Africa took time to learn from COVID. Everything we are doing today, we say we were abandoned during COVID time. And today we don't want to be again abandoned. We don't want to be dependent. We are taking appropriate action. We are deciding when there is an emergency, we are making appropriate decision and we are speaking with one voice. This is why we say we are moving on. We can contribute. We are contributing at global level. You saw the role we played as Africa CDC to facilitate the pandemic agreement. Let me also call upon all of our partners to finalize the pandemic agreement. Because when we are negotiating the pandemic agreement, we didn't know that we'll have this to declare a public health emergency of continental security in a few months. We call upon all of our partners because we resumed the negotiation in Geneva to finalize a fair pandemic agreement that can help Africa and other parts of the world to have access to countermeasures when we need it. And Ebola, quickly, Dr. Merawi, can you please provide some information about the suspected case of Ebola in DRC now? If we don't have Dr. Merawi, then Merawi, are you there?
Yes. Yeah.
Okay.
Yes, we are here, DG. Yeah, just to say that we met the National Public Health Institute this morning. There are 7 cases that have been reported in Chuapa, which is the Grand Equateur province. They faced samples, I think, that were analyzed. All of them were negative. But the problem that given the fact that those areas are very remote areas and it has taken a long time for the samples to come out to the laboratory, the main observation is that the quality of the samples was not good and adequate. For that reason, I think another team has been deployed there to redo the sample collection and then redo the analysis. I think that's the stage where they are, but the symptoms are very similar to the hemorrhagic fever of Ebola, and this is also happening in people that are very experienced. That means that we are still waiting for the confirmation to know whether it is finally Ebola to ignite the response. But now they are at the investigation stage. That's why the country is right now.
Thank you, Dr. Ngashi. I think we've come to the end of our press conference. We are over time. I'll just pass the floor to the DG to provide closing remarks.
Dear colleagues from the press, we wanted to thank all of you for attending this meeting. The main reason for us to have it was to ensure that you can help us to provide appropriate information to our communities and our partners. Mpox is a reality. Mpox is affecting our countries. People are dying, and you saw the graph. Now, if we compare for the same period of time, 2023 and 2024, we have an increase in terms of 160%. And this is huge, and we need to address that. The second one is about by your engagement, you can also help to mobilize the international community to know that something is happening in Africa. And if they don't come to work with us together, they can also be affected. And we don't want to see again the world being affected as it was the case during COVID. This is why we need to take proactive action now. The third reason is we want to ensure that there is a pilot on board, and the pilot, based on the mandate given by African Head of State and African Union, the pilot is Africa CDC, working with all partners. As I said, we really thank WHO under the leadership of Dr. Tedros, but also my sisters, Moeti in Afro and Anan in Embo. We thank UNICEF, and I wanted to thank the two deputy executive directors, Omar Abdi and Ted Shaiban, plus the regional directors. I want to thank Gate Foundation. I had a nice communication with the president of Gate Foundation, with CEPI, with Global Fund, because now we see the correlation HIV and Mpox. I want to thank Gavi, my sister Sanya, who's the CEO, for the support that we are getting. We want to thank Wellcome Trust, EDCTP for the clinical trials, and so many other partners, including manufacturers. We are talking about the Japanese company, we are talking about BioFac. They are all of these partners who want the press to help us to say, in addition to them, the whole private sector, we are together to work and to lead this response. We will have this engagement for the time we think that there is acute outbreak on weekly basis. Next week, maybe on Thursday again, my colleague, Director Margaret, will share information with you. It will be transparent. You can ask any question you want. We want our communities to be informed and to be engaged. The last one, please help us to reach out to youth and to give opportunity for them to take the lead. From our side, we know what we need to do. I gave you some steps. We know that next week, more likely, the Director General of Africa CDC will declare the public health emergency of continental security. You can share this information because this is what we'll do based on the advice that we will get and the guidance, also political guidance that we are getting from our leaders. That one will help us to have an appropriate response and to help to stop this outbreak and also reinforce the health system in Africa. I thank all of you for attending.
Recording stopped.